Dr. Angie Settle from West Virginia Health Right with Your Health Done Right. We're so glad that you joined us today. I'm really excited to have Ryan Lindsay. He is West Virginia Health Right's board president with me today. And we're really excited because we just left the East End Clinic where we took a top to bottom tour of this newly expanded space. We talk just health related topics here, but I do want to talk to you guys today about this. It's such a great event. It's something that's been 5 years in the making, but we want to say hello to Ryan first, and we'll let him tell us a little bit about his background and his role on the board.
Absolutely. Well, thank you so much, Angie. It's great to be here, and it's a wonderful experience to see this Health Right Clinic expand and all the efforts that's been put into that over the years. I'm the board president, and I have been on the board for 8 years and served different roles. I've come from a finance background. I'm a partner at a local CPA firm, Grey Griffith Mays. And with that, I brought a little financial expertise to the board. I do a lot of work in the healthcare field, so I am able to kind of help bring that connection to the board. And it has been such a wonderful experience. It's such a great group of diverse individuals that have come to that board and watched that organization grow. And today it's just been great to kind of sit with you and kind of revisit the memories that we've been through, some of the battles we've been through over the years.
Absolutely. So we won't tell all the sordid details, but we'll just give a little bit of background for the viewers, and of course we'll go talk about the mission and what the meat of it or what we're doing there. But so it's 2019 is when we first started saying that we needed to expand. And of course, with good planning, like a board would do, you need to go through all of the steps. You can't just start building the next day. You got to go through all the steps, and we went through all of that. And then COVID hit. So in the middle of all that and fundraising and all, we start doing these massive drive-throughs. We ended up being the #1 COVID testing site in the state of West Virginia with over 100,000 free tests. We plugged along, we designed, we did all that. But the main reason, which we'll talk about, is, when I became CEO, it would be 10 years ago soon, there were 15,000 patients at Health Right, and now we have like 44,400. And that's because of need, of course. We talked about that. Supporting people, the working poor, and some people say, oh, you shouldn't say working poor. I say that with love. This is my community, these are my neighbors. Working poor, they're poor, but they're working every day and they're trying very hard. And that's what we do to support people. And it's just been through expansion of programs and all the things that we do. You know all this from being on the board.
Absolutely. And for those individuals that are working, they're trying to raise kids, they're trying to do the right things with their families. Those healthcare costs and those pharmacy costs can be such a burden to those budgets. And I've seen from a financial perspective, a lot of people really suffer through some tough times with medical burdens and financial burdens that are related to medical procedures. And then you certainly understand parents not going without medical treatment because they just simply can't do it. Their kids need clothes. They want to be part of sports. They need sports equipment. They're spending money on the kids, the next generation. But sometimes mom and dad don't take care of themselves.
Absolutely. We've seen that time and time again, because it's hard to understand it until it happens to someone in your family or you. A lot of people live paycheck to paycheck, and they're just, one thing away, one catastrophe away from needing help. So that's something we pride ourselves in for those people who need us long term, or those people that maybe are in between jobs or whatever. But so we'll talk a little bit about what we got. I mean, we know we have the West Side facility and the one at Covenant House and the 2 mobile units, but this we call it the hub, the mothership of Health Right, because it has the dental and it has pharmacy and everything like that. But lots of planning has went into it.
Absolutely.
And I think the thing that is so unique about it is, all the old space that we used and housed everybody in is now a dedicated behavioral health recovery center. We can talk about it for days, but West Virginia certainly suffered from the opioid epidemic, other drugs like meth, etc. And with COVID too, we've seen the skyrocketing numbers with behavioral health issues. People that suffered from it before, people that had new diagnoses from just all the collateral damage of, being in the house and away from people and all that, struggles of money and all of that. So that's a huge need, huge need. I would say at least it's getting closer to, I'd say 40 to 50% of our population suffers from something in that realm. And now we're going to have that entire space as a dedicated behavioral health recovery center to help people with substance use disorders, and even like a separate entrance. And I think that's great. That's definitely something needed in our state. There's not enough behavioral health services. And when you think about needing behavioral health help, and then you think about having no insurance, it's hard enough if you have insurance to get people access to care with rural routes and all of that, and geographic challenges and lack of providers. But then when you pair that with somebody that's lower income and they don't have insurance, it's next to impossible. So that's something I'm really proud of
Absolutely.
as well. Yeah.
I mean, a lot of my clients are the behavioral health centers throughout the state, and to see them finally getting some attention, that area of healthcare is finally getting some attention from a financial standpoint, where dollars are starting to come in and be able to support programs like the one we have set up, or the ones they have tried to keep afloat for so many years and struggled for so many years. And now some of them are doing a little bit better, and now they're able to really be a bigger impact to their communities.
Absolutely. And you can never have enough. I think it's so important when you look at somebody who's wanting to get into recovery and they're ready, today's the day, they're ready to get in recovery, that we can get them in somewhere.
Yeah.
That we can access that. So, we have behavioral health people on site, licensed professional counselors, psychiatric nurse practitioners, recovery coaches there, ready, willing, and waiting. And actually, it happened just the other day. A local business owner had somebody that worked for him that was struggling and had a substance use disorder problem, and they were really in a bad way. They called me up and they said, Angie, I've got this person, they're ready, can you help me? I immediately got my recovery coach on the phone, got my staff on the phone, said everybody be ready, he's coming, and got it rolling, and he immediately went into recovery, and now he's going to go into long-term recovery. But that's how you have to be ready.
Yeah,
Because
absolutely.
people come to that on their own time. You never know the day, the hour, the minute that somebody's ready to go into recovery, and it's so important that you roll with that. And that's something kind of unique about Health Right. You can't just sequester times like, oh, you come at this time or come at this time, or, oh, we don't take walk-ins. You really got to just be ready whenever they come in.
And it's been that way forever, and I'm sure we showed that a lot during the COVID period when we were open 24/7. It seemed like getting phone calls or finding the needs and trying to serve the community.
Yeah.
And we post hours for our staff. Of course, they've got to go home to their families occasionally, but really it's 24/7. I mean, there's access that's available. And
absolutely, we do after hours call. Absolutely. So even if somebody decides, and that's happened, on the weekend, Christmas Eve, okay, now I'm ready to go into recovery, we're able to get those calls and help them do that. So I'm proud of that.
That's amazing, yeah.
So we have all the new exam space, new procedure room, the lab's been expanded. I mean, it's nice to have actual space, not have people walking on top of each other. The pharmacy's been expanded. We have a space now so that the pharmacist can take somebody to the side and, actually counsel them and do that one-on-one stuff. We really try to bolster local universities and their programs. So like pharmacy students and stuff are there. So that's great. That's just on the first floor.
Yeah.
So tell us a little bit about what you saw there on the second floor.
It is an amazing facility, and what I saw before was staff and volunteers and patients on top of each other. And now there's so much more space to spread out throughout the facility. I saw secure doors and entranceways, which is fantastic to see. I mean, our staff have their dedicated space. They have very private offices now, where before many of them were on top of each other.
Right.
And I mean, when we had our board meetings before, we had to kick people out of the boardroom because they were using it as office space at times.
Absolutely, and that's really hard, especially in today's time with HIPAA and the privacy issues and trying to get space and all that. So that's something I'm proud of, though, that we never closed our doors. We stayed open the entire time. I can't give enough kudos to BBL Carlton, who did it. ZMM did the design, but they were able to work around us. Jacob and all the guys over there, they were so good to work around us, and we were able to keep every area open. We kept the pharmacy open. We kept providers there. We never closed. And that was a challenge.
Yes, absolutely.
Those Zoom calls with the pounding in the background, that was always interesting to try to explain those.
Yeah.
But it's, it's 5 years and finally see it come to fruition. But, we expanded the dental space. We now have a lab area there. It's all treatment-related space.
Absolutely.
Vision area where we do free eye exams. Now they have a dedicated waiting room. I'm really adamant about the client experience and treating people with respect. And I would hate it when we'd have people, have their seats along the hallway there.
Yeah, I remember that.
Now we have a
Right. dedicated
space for people, that they can.
And a lot of times
see.
people are coming with family members, or coming with a
Right.
spouse, or they're coming with their daughter that's bringing mom, or vice versa.
And their kids.
Yeah,
and all
so
that.
I mean, they
Right.
need space to be able to have and wait and be ready for their patients. But
Well, bringing up the kids, while we're at it.
Absolutely.
Shayla Leftridge, she has an artsy side to her, and she did our stuff on the west side. We gave her the kids' room. It's called Hope Cove.
Yeah.
There's a theme there. We have a program, Hope program for recovery. A lot of people, moms, dads, whatever, in recovery, or people that with their kids or that are trying to get their kids back. It's really hard sometimes to have childcare. So we have that dedicated space there for their kids, where we have safe people on staff that will watch their kids while they're seeing, the therapist or whatever they're getting done there. And I saw that for the first time today. So it's like a little seating
now,
area.
you're going to have a hard time getting those kids out of there, I think. That's going to be the problem now.
I'm bringing my youngest today, and she's going to play in there.
Well, that's great.
But just a fun, cute area. It's underwater theme, and just a cute space for kids to be welcomed and loved on while their parents get care in a safe environment. So we're excited about that as well. That is 2 on the first floor, and then of course we got the 3rd floor, which is like the offices. You got to have those.
Yep.
Where the boardroom is. But our grant staff, it's important to have space where people can meet together and talk. We do a lot of strategizing, a lot of fundraising efforts, and now we have space to do that.
Some
Before
small meeting rooms for
Yes.
collaboration and everything.
Like even in my office, I got a little table now. I'm really excited about it because I've always had hand-me-downs, right?
Yeah.
And free clinic, you're always trying to watch. So I got a little table in there so you can actually meet with our staff if we want to strategize, and we don't have to eat our lunch on our laps and that kind of thing. So I'm really excited about that as well. And then, of course, we got the honor wall there in the boardroom where we've gotten so many awards over the years for different efforts and recognition, and we've had them just everywhere in drawers, and now we have them like on a wall, and it kind of makes you feel good to see all of that up there,
How
so
far
you
we've
can
come.
reckon how far we've come. Is
That's right.
exactly right. But talking a little bit too about we've talked about the expansion and why it's there, and we want to welcome anybody that wants to come down and see it, because this is definitely the funding. Let's talk a little bit about the funding, because that took a lot of effort.
Oh, yeah.
It was a $12 million project all in. That is including, getting the property next door and all the space. If you've ever tried to do any kind of expansion in downtown Charleston or anywhere, we have to do your due diligence, go through the planning committees and city, and of course all that. But it can get interesting, and it takes a little bit of time, especially when you're trying to figure out enough parking, and you want to make sure you're cognizant of the neighborhood and respect all the neighbors, and demolition. It was just, and then COVID. It was just a lot of stuff. So it took a lot of time, but we were successful in a lot of grant writing. We were able to get a $4 million budget appropriation from the federal government that Senators Capito and Manchin really fought for, and that was, the main seed money that got us going. And then we were blessed because Governor Justice in the state of West Virginia then matched that with $4 million, which got us to $8 million. And then we were blessed with the county, Kanawha County, and the commission giving us $1 million, and then the city of Charleston, the mayor Amy Goodwin doing, and that was ARP funding, which got us to 10.
Yeah.
We were blessed to then go back to the county commission. They gave us another $250,000 for the furnishings in terms of medical equipment and labs and tables and everything like that. And then the other $2 million was different, private grants, organizations, fundraising,
Foundations,
all of those efforts over the years. I teased somebody yesterday and said, well, I thought about baking cookies and selling them to that, but we didn't. It didn't get to that point. And we're really, I was telling you on the way over here, we're excited that we wrote the last check, and it's totally paid for, the entire building.
Which is just amazing.
Is amazing. And people look at it and say, oh, well, Health Rate's, asking for money for this and that. But, when you get a project like this on top of a nonprofit that depends on grants and stuff just for programmatic, and you're caring for people that are low-income at no cost, and there's no charge to them, about 85% of our budget has to be done through fundraising and grants and everything like that. It can be challenging.
Yes.
Because you've got this fundraising to go on, and then you've got this fundraising to go on to just meet budget. But it's so important that we had this space because we were just busting at the seams.
Absolutely.
I mean, to keep taking patients that come to the front door in need and just be, and staff and need more staff, but have nowhere to put them, it's been interesting. You've witnessed that.
We're so blessed to have so many funding sources that supported this expansion project and previous expansion projects, the West Side Clinic and then the dental clinic, the mobile dental clinic that we've had. But that goes to show who we're serving and who's benefiting from the services that are coming from the clinic. And it's not just the city, it's not just the county, it's the state, it's the whole nation. And really, it's a beacon. I see Charleston is in a little bit of a revival process right now, and I think that this clinic is part of that revival. I'm seeing more cranes and development, and you're seeing parks and festivals come back. And I think it's a great place to live.
Absolutely.
And having a clinic that is available to some of those servers or retail workers or people that they make a good wage, but maybe not enough to have their own private commercial insurance, and maybe they don't qualify for some of the other packages. So this is a place for them to kind of land, and it's just such a wonderful thing to see, to not have the burden of debt, which I certainly deal with a lot of my clients, and rising interest rates and canceled or delayed capital plans because of the rising interest rates and inflation, and of course competition for jobs. And one of the things that I'll say that I saw when we went through there was the staff's true joy of being there today. And they've always had that joy, but today was a special day to see their eyes light up when we talked about what they were doing around the clinic, and I got to meet a few that I hadn't seen before, and just seem they're part of giving back to this community.
Absolutely.
That is a calling for a lot of them, and every little person there does something that matters. That matters.
That contributes.
And so it permeates through the culture of the organization.
Absolutely. It does.
It is a great place to work. But now you don't have to sit on top of your colleagues all the time. You've got your own space, and you can actually serve these patients a little better.
So
more comfortable.
and I agree with you. It is for the patients. It's for the community, but it does bolster employee morale. When you work in a nice environment, things are clean and fresh and new. It does bolster productivity. It's hard work. What we do is hard work. We see people in so many challenging positions and really hurting in life, and it's hard not to take that home with you every day. We do take it home. But things like this and having a nice environment and a breath of fresh air and being able to offer privacy, when that mom's there crying about, their son who fell off the wagon and recovering, and you need to talk to them. It's not great when 4 people knock on the door and they're trying to get in and out of there, but now we have that great dedicated space. So I'm really excited about that, and I'm glad you noticed that, because that's something I think so important.
It is.
And we got that award. We'll talk about it. I can't remember the name offhand, but from the West Virginia Nursing Association.
Yes.
For being one of the best employers for
Beacon
nurses.
Award, I believe.
Beacon Award. See, he actually had to get that.
I attended the ceremony.
He attended it for me. I couldn't be there, and we got that award for being a positive light and a role model for nursing, and that's something I'm proud of, because we know how hard it is in the nursing profession, medical profession as a whole. So much burnout.
Yeah.
So much burnout during COVID and all that. And we really don't get a lot of turnover at HealthRight.
Yeah.
We do not. Sometimes people, it's great if they get another degree and veer off and opportunities and all that, or they have to
or
move.
life change, family life
like
change.
They have a baby and they decide they want to be a stay-at-home mom.
Sure.
But as far as like a lot of turnover, it's not an issue, and that's something I'm proud of. Absolutely, because we all know how much it costs to train and retrain, especially in specialty areas like this, especially with our population. It takes so much time to get to know what we do, because we're such a unique entity in everything that we do. But going back to what you were talking about, excuse me, about 55% of HealthRight patients are uninsured. 83% are employed.
Yeah.
Which people are like, wow, because we are a free clinic. We do help people that are unsheltered. We do see people like that. But the bulk of our patients, which is a message that I'm always telling people when I'm talking to the legislature and just people in general, the bulk of who we serve is people that you run into every day. The person that you see when you go in the gas station to buy that Diet Pepsi.
That's right.
The person that you drop your kids off at daycare. The person that serves you dinner on that Saturday night when you go out somewhere. Those are the people. Those are the people that we serve and that we help every day have those expensive medications. A lot of people don't understand COVID also impacted pricing. We saw how how bad inflation.
Totally.
Medication prices have just skyrocketed. We know that the state struggles so much with obesity and smoking and diabetes and high blood pressure and heart disease. It's nothing for us to see a 36-year-old male come in on 5 or 6 medications that if he would go out and pay retail $850,000 a month.
Right.
So what people are often faced with is a decision. Without Health Right standing in that gap, they're faced with, okay, I want to go to work. I love my job. I want to contribute. I want to do, it's good for the soul. But I can't afford that medication. So I'm going to have to either A, go without it, B, try to make it stretch and not use it the way I'm supposed to, or C, quit my job, become poor enough to qualify for Medicaid.
That's right.
And that's where we struggle because we want to help people. We want them to be pushed forward. Also, people, we've seen this time and time again. People may be in a job just starting out, and they qualify for Medicaid. Them and their kids qualify for Medicaid. They've worked hard. They get a raise. They get $1 raise on the hour.
Yeah.
Suddenly, they make too much money. They don't qualify for Medicaid anymore.
That's right.
So they've been incentivized. We want them to work harder. We want them to do well. They get the raise. And now, one step forward and 2 steps back.
Or other programs. They might be on HUD or something like that. Maybe they don't qualify for HUD. That's the thing. There's a lot of programs out there that I think will get people from the basement to the first floor.
Absolutely.
But how do we get them from the first floor to the second or to the third floor? Keep moving up in society and people that have gone through recovery. There are programs that put them back out in the workforce, but they need more than that. They need more than just that gas station attendant job that you mentioned. They need help so they can get their families and get their lives on track to where they can actually be a perspective, be a good force in the community, give back. And stand on their own 2 feet.
So that's something I'm proud of because, we do see people with Medicaid. We do see people with Medicare. Everybody's under 250% federal poverty level. We get tax returns.
Yeah.
We get proof of it. All of that every day. But I'm proud that if, Sally is on Medicaid, but Sally gets this great job and suddenly she's making $2 more an hour and now she can't get Medicaid. Sally can still come to Health Right. Sally's not going to see a change in her care. Sally's still going to get her seizure medicine and it's going to be the same. Sally's still going to come. There's no seams in that. You don't have to deal with going to a private practice. Maybe, and nothing against private. They got to do their thing, but go to private practice, suddenly you become uninsured and you can't be seen unless you pay up front.
That's right.
And then you're without care suddenly. So I like that that's seamless. That's something I'm proud of, that we're proud of at Health Right is that Sally sees no change.
That's
Sally's
right.
also going to get those wraparound services of health education classes, learn how to cook healthy. Maybe Sally's in recovery and she's trying to be a good mom. She wants to learn how to cook healthy for her kids. She's trying to do that
Absolutely.
stuff. We want to help Sally learn how to cook those meals in our teaching kitchens and do those classes specific to recovery. Maybe Sally, wants to go to the free gym because it helps her, maintain and deal. And we know how important physical activity can be for overall behavioral health. So all these little things that a lot of people don't think of that we, as a board, myself, my staff, have collected over the years from our experience. And I can't tell you how much that we've learned from our patients over the years and listening to people, the things that make a difference. I got to count, since 1997, I've been at Health Right, all the things that you collectively put in the back of you, that you learn from each patient, that you see, and what makes a difference. And I think that's where we've seen so much growth in the last decade since I've been CEO and everything, is collectively getting to hit all those marks of the things that we knew were really needed and having that opportunity. And this expansion really brings that to fruition because our goal is to have a one-stop shop.
It is. It used to be a one small stop shop. Now it is it's almost like the Epcot Center of free health clinics.
Yeah.
I mean,
we went from 15,000 square feet. I think we got 32,000 square feet now.
Yeah, I mean it is amazing, and it is transportation. We've talked about a lot
Yeah.
about that with the board and with the staff, how that is such a barrier for healthcare in not only the rural
Right.
areas but the urban areas where people have trouble. And if you have to go multiple places, if I have to go here for recovery and I have to
that's
go
it.
here for behavioral health, and then I need to go here for medical,
There
here
it
vision
is.
and dental. That takes up so much time and so much transportation challenges for those individuals.
Absolutely.
That now you can come to Health Right and you can do 2 or 3 of those in a day. Come back one more visit, do the other 2 or 3, and you've got your whole.
And I think that what that in a nutshell is probably the most important thing we've said today is that. Because people, and I've learned this, if you have a person who struggles with transportation, childcare, etc., you have them here. And then you say, okay, now I need you to go to Dunbar. I need you to go here. I need you to go there. Like one of the
Yep.
things we offer on site with the help of CMC is a DHHR worker who's dedicated there every day, full time, to see patients, help them see if they enroll in Medicaid. Do they?
Sure.
Is there other benefits that they can do? They don't have to get on a bus and go to Dunbar. You lose so many people when you say, hey, I need you to go here, 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 and here. Even like for a specialist. We're going to set you up an appointment and you're going to go over here on this day. Having the volunteers come in-house. Our providers can go and talk to the volunteers while they're there, especially in cardiology and actually like chairside consult. Hey, you saw Miss Smith. What did you think of that? Hey, we need to do this. And they get that immediately. We get those records back. You're not spending days on end calling this office. I need to get the records from where Miss Smith was there. Da, 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 da. It's all one big system. And if I can, say it again, like you said, if that one-stop shop, as many services and opportunities that you can add in one location at one stop. Again, being very patient-centered. I pride ourselves in being patient-centered. It's not about our schedule.
Right.
It's not about what works for me. It's what works for that patient.
That's right.
What works for that patient. And I think, I'm proud of that fact. I'm proud of all the thought and effort, and so proud I've got the best board of directors because, sometimes we come in with these crazy ideas and stuff, put a little thought into them, and they're good at wrangling me in. But generally, we go forward with stuff that's going to work. And if at the heart of the mission, if it works with our mission and we know it's going to put things forward,
we talk a lot about
that. We go
that.
for it.
Yeah, and with this East End expansion, you couldn't have anticipated all the hurdles that we had to go through. We had so many things
hurdles.
that licensing and permits and all this stuff that we didn't. We sat in that boardroom those first few meetings and talked about things, and we did our best to identify. Of course, we talked a lot about fundraising. Where are these funds going to come from, and how are we going to pay for this? Not only to build it, but also to sustain it. And so that's our next challenge is, we've got a lot of funding that have come to our organization to help build this expansion and of course build the West Side and do dental. And now we need to continue that mission.
So that's the perfect thing to bring us to a wrap here on our show today. Just know, we're still in need because now we got to support this and support our programs, which is something that we do all day and we're committed to. But I want to thank you, Ryan, for going on our tour, coming on the show today, seeing what I'm doing when I'm talking about being on the show, and just talking about Health Right. I can go for hours talking about Health Right.
Well, it's a pleasure to be here and an honor to be on this board.
Thank you so much.
Thank you.